Good morning and welcome to today's Mental Health Australia webinar. For technical assistance, please phone Redback Support on 1800 733 416. If you would like to ask our presenter a question, please use the chat box which is on the left-hand side of your screen, just to the right of the cogwheel. Once typing out your question, hit enter to submit. I'll now pass you over to David to begin.
Thanks, Jeff, and welcome everyone to this webinar, which is designed to inform people about the project being led by Mental Health Australia on optimising support for people with psychosocial disability in the NDIS. Our goal today is to ensure that a substantial proportion of the stakeholder base that are interested in what's happening with the NDIS have an opportunity to understand what we're attempting to do with this project, have an opportunity to foresee what its outputs might be and what impacts they might have on business practice and on experiences of people within the NDIS, and hopefully to garner some additional information from all of you out there that might assist us to refine the outputs and to provide us with an opportunity to get additional evidence that provides us with a better product at the end of the day. So thank you for making time. We really appreciate you making time to hear about the project, and in advance, thank you for any assistance you provide once we finish today on getting the project to its end point. I might briefly take you through what the project's designed to achieve, provide you with a little bit of guidance on what we've done thus far, let you know what we intend to do next, and then provide you with some contact details to get back to me or to Mental Health Australia on thoughts that you may have that might move the project forward. So if that sounds reasonable, I will provide you with an opportunity for questions at the end of my presentation, and I'm happy to answer those to the best of my capacity, or alternatively, Belinda and Kat from Mental Health Australia will do their best to provide you with relevant advice. Jeff, if you don't mind switching to the slides now, I'll take people through the project. Thanks very much. So the title of the project is Optimising Support for People with Psychosocial Disability in the NDIS, and obviously the intention there is to ensure that the support delivery process, and particularly the planning process associated with people's entry to the NDIS, is better than the experiences that people describe that they're currently having. That's better in terms of participants' experiences, but also better in terms of service providers' understanding of how that planning process works and how it then translates into providing services to individuals in the scheme. So the purpose is to improve participant planning processes in the NDIS for participants with psychosocial disability, to optimise the investment approach to participant plans. And what I mean by that is to ensure that when funds are being invested in providing support, that they provide the sort of outcomes that people would hope for from participating in the scheme. We're also hoping to improve the appropriateness of activities available for purchase within the NDIS. And that's to ensure that the sort of activities that people with psychosocial disability will benefit from are available to be purchased. It's clear what they are. When they appear in people's plans, they have an understanding of where they can go to get those services, and service providers have a degree of certainty about when they provide services that they will be therefore funded by the NDIA subsequent to providing those services. We're also interested in improving the matching of participant needs to agreed activity, and what I mean by that is ensuring that when somebody begins the planning process with a planner at the NDIA, their particular needs are identified more effectively and then matched to the sort of activities that are available for purchase in an effective way. The final task is to develop what are called typical support packages, or they're sometimes referred to as reference packages. If anybody out there is familiar with the documentation that the NDIA uses, they use both those titles, but they mean roughly the same thing, to improve the consistency of the planning process. The logic behind these typical support packages from the NDIA's perspective is to assist planners to have a start point for a planning conversation. It should only be a start point. Our intention is only to create a reference point for planners, not a sort of Happy Meal style, you must purchase this particular suite of things. But it does provide some guidance to planners who aren't always expert in psychosocial disability, and could be assisted, I should say, with some guidance by typical support packages. The project outputs will be an addendum to the price guide with revised activity definitions and new line items for people with psychosocial disability, I imagine many of you who have an interest in this particular webinar are familiar with the price guide and how it works. It comes with what's called a CSV file, which is an Excel file available on the NDIS website in the pricing section. That particular file provides the list of all the activities that can go into an individual's plan and are available for purchase. We're reviewing that list, looking for additional line items that might be relevant, and also revising the definitions in that list to make them more appropriate for people with a psychosocial disability. It's intended to operate as an addendum, so for somebody who's entered into the scheme with a psychosocial disability and where there's a definitional difference between the addendum and the existing CSV file, we intend the addendum to be the one that operates for that individual. Of course, that would require, and we intend to negotiate with the NDIA to head towards that particular outcome. We're also looking at a suggested phased approach to participant plans, and without presupposing the outcomes of that particular deliberation within the project, we're intending to work towards a particular approach where there is an initial phase to somebody's plan that may be adjusted over time, and we're looking to provide guidance for how that can occur and what sort of balance of activities over that time phase may be appropriate. We're also looking at improved allocations of participants to categories of like support need. Currently, the NDIA has a process, as documented by the Productivity Commission, to categorise the basis of functional limitation, and then on the assumption that that will require similar types of support need and therefore allow similar types of packages to be provided to those individuals. We're hoping to come up with an improved method for allocating participants to categories, and then once that's done, to recommend appropriate support packages for each of those categories. And that's the material and most substantive part of the project. Just important for me to point out that the project only addresses psychosocial disability participants. We're silent on how the project may apply to other categories of participants. Obviously, if the NDIA finds any benefits from the work that we do that may apply to other categories, they're welcome to make that application, but the project only intends to make recommendations with regards to people who are entered into the scheme who have a psychosocial disability as their entry criteria. Just briefly, so you understand how the project works, and perhaps to reassure you all that it's not just ideas coming immediately out of my head, it's important to understand the people who are involved in the project. There's a project management group comprised of funding partner agencies who have put forward their own capital to ensure that the project proceeds, and Mental Health Australia, who's the project partner, for want of a better phrase, who is leading the project and managing all the logistics and contract management under the project. Mental Health Australia has commissioned myself and Debbie Kaplan, who's supporting me in this project, under contract to undertake the technical work. There's been an expert group commissioned. Their job is to consider propositions put forward by the project team using a modified Delphi method and to make decisions on recommended changes or to guide the project team in an alternative direction if they don't like any of the propositions that are put forward. The expert group includes lived experience members, academics, service providers, clinicians, and of course the project team itself. There's also a lived experience reference group, and that's been established to critique the outputs of the expert group, to refine it where it can be, to test some of the ideas and to provide an alternative view on some of the assumptions that the group may have made. We also have what I'll call a data expert group, which is really an ad hoc communication between me and a set of identified data managers in each of the partner agencies. Those partner agencies are providing me with data to make to assess and analyse assumptions of the group and to ensure that those assumptions are backed by the experiences of people not only in the NDIS but also in other like schemes that provide psychosocial support to people with psychosocial disability. Briefly, and I apologise if this gets a little bit dense at times. As I said, there'll be opportunities for questions at the end of the presentation. I'm going to briefly talk through where we're targeting our work within the hierarchy of documents that actually describe how the NDIS works, and particularly how those documents relate to decision making within the NDIA. So obviously the top of the tree is the NDIS Act, which is a Commonwealth Act, which requires amendment by the Parliament, and it provides the broad framework for how the NDIS operates. I assume many of you are familiar with the Act, and particularly Section 24, which provides the entry criteria for the scheme. We're not seeking, in the main, to target changes to the Act. It may be that as the group deliberates, we come across particular things that may require deliberation on the content of the Act, but acknowledging that that requires the Parliament to make changes, we're not focusing necessarily on that level of change in the scheme. Underneath the Act are the NDIS rules, which operate similar to regulations, which can be amended by the Minister. Those rules specify communication and guidance by the Minister to the CEO of the NDIA on how the scheme should implement particular aspects of the Act. Again, they're not the focus of the group's activities. We may make decisions to make changes to the rules, but they're not necessarily the focus of the activity that we're looking to change. Underneath those are operational guidelines, which include an outcomes framework that's been developed by the NDIA. And you can think of those as communication between the NDIA CEO and his staff about how they should make individual decisions for planning decisions or other operational decisions within the scheme. And that's the level where we're targeting most of our thought processes, because those particular guidelines and policy frameworks can be amended by the NDIA CEO, and therefore the level of advocacy and political capital that's required to get them changed is more manageable, and also that they provide the level of detail that allow us to make substantial changes that will get better outcomes. And really, they're the particular level of detail that impact on people's day-to-day experiences in the scheme. So just to sort of continue the analogy, the Act is a way of the Parliament giving the Minister particular guidance on how the scheme should operate. The rules are how the Minister gives the CEO guidance on how the scheme should operate. The operational guidelines are how the CEO gives his staff guidance on how the scheme should operate. And that's where we're trying to target the project. Just within that, the price guide and price list that I referenced before are really guidance from the NDIA CEO to service providers around how they will interpret plans for the purposes of service providers being able to be recompensed for their activity. They're also available to be amended by the NDIA CEO, and obviously, as I said in the first slide, that's a particular target of what we're trying to achieve. I referenced before Section 24 of the NDIS Act. This is the section in the Act that describes the disability requirements to enter somebody into the scheme. I haven't provided all of the sub-clauses in the Act, but I just want to draw people's attention to this particular sub-clause, which are the 6 areas of reduced functional capacity or psychosocial functioning that are required to be demonstrated in order for somebody to enter into the scheme. This is the fundamental entry criteria for somebody to be considered to be a participant in the NDIS. It's interesting that generally the individual as a participant is not made aware of which one of those 6 criteria they may have met in order to be entered into the scheme. It's not noted in participant plans, and service providers are never given the information around which of the reduced functional capacity requirements were met to get somebody into the scheme. I just point that out for the purposes of some of the later deliberations in the project. This is an example of NDIS rules, and my purpose of going through these levels of the documentation is to demonstrate the level of specificity in each level of the hierarchy. You'll notice as we go down from acts to rules to guidelines to the guide, the specificity gets greater and greater, which gives us more room to make changes as the specificity gets greater. The NDIS rules, this is one of the rules around support for participants. There's a number of rules. There's not just one set of rules. Each rule has a particular focus, and this particular focus is on support for participants. You'll notice that Introduction to Support for Participants, Rule 2.1, describes what the two primary components excuse me, are of somebody's plan. The first is a statement of the participant's goals and aspirations, and that should be prepared by the participant and specifies their goals, objectives, aspirations, and circumstances. The second component is a statement of participant supports, which is prepared with the participant and approved by the CEO and sets out, among other things, the sort of support that will be provided or funded by the NDIS. Now, they are relatively concrete parts of the plan, but obviously the rules do not specify in great detail the elements that underpin each of those two parts. In determining what is effective and beneficial practice and what should be incorporated in particularly the second part of those two rules, the Minister has specified rules to the CEO on how to make determinations around what should or shouldn't be included. The reason I focus on this is it provides a framework for the project that we're working on, because the NDIA CEO is required under these particular rules. If you notice it's 3.3 in bold, and that bold has been added by me, it's my emphasis. In deciding whether the support will be or is likely to be effective and beneficial for a participant, having regard to current good practice, the CEO is to take into account and, if necessary, seek expert opinion. And we're framing this project as a project based on expert opinion and working on the types of evidence that are described in the clause above, published and refereed literature, lived experience, and anything the agency has learned as the framework for our process in this project, which requires the CEO to take it into account in his deliberations. It's a powerful mechanism. It's a powerful mechanism for us to make decisions around changes to the scheme that are likely to have benefit at the end of the day. I've noticed I'm starting to get a couple of questions. I might deal with those questions at the end, if that's all right. I may address some of them as I go, and I recognise me talking for a length of time is not the most interesting way of presenting, but it's probably the most effective way to get as much information as I can out to the range of people online at the moment. So I will come back to you, Laura, on your question. General criteria for supports under the NDIS rules, 5.1, these are the 4 criteria. They're relatively sensible criteria, but it's important to pay attention to criteria C under that list, where a support duplicates other supports delivered under alternative funding through the NDIS. It won't come in as a support under the plan, or if it's not related to the participant's disability, which is criteria B. So it's important for the purposes of the work the group's undertaking to keep those criteria in mind in making decisions around alternative activities that should be added to the price list. There's also within the rules, in this particular set of rules on participant supports, so I'm still within the same set of rules on support for participants. At clause 7.6 and 7.7, there is actually specific reference to mental health. This is due to some of the unclear delineations between existing services provided by states and territories and the services that will be provided by the NDIS. This particular set of language is very clear about not providing supports that are clinical in nature and therefore makes a clear delineation between clinical mental health services and psychosocial support services. Clause 7.7, which states that the NDIS will not be responsible for particular things, has a slightly problematic subclause at clause A, which says supports related to mental health that are clinical in nature, including acute, ambulatory and continuing care, rehabilitation/recovery. And obviously that last addition of rehabilitation and recovery is problematic in terms of it's not defined elsewhere in the rules and creates ambiguity for NDIA planners around the boundaries between relevant supports that should be included and those that should be excluded on the basis of the rules. We may come back to that again later on. Laura has asked me a question, does the project also target customers with dual diagnosis? The 7.7D goes some way to answering this question. It says that supports relating to a comorbidity with a psychiatric condition where the comorbidity is clearly related to the responsibility of another service system. We have deliberated within the group around what that means in terms of boundaries with other forms of dual diagnosis. We think there's a clear boundary with drug and alcohol use, as it's actually named in the rule. Whether there's that clearly delineates psychosocial disability and other forms of disability, I think is debatable, and I think we do have scope to think about the relationships with other forms of disability as part of the project. I'm not going to talk at length about the operational guidelines. There are 8 operational guidelines, including one on planning. These documents are used by the NDIA staff to make day-to-day decisions based on the rules and the Act. They are the operational documents that interpret the legal documents for the staff, if that makes sense. We will come back to the operational guidelines at the end of the project, so those of you who back up for the second webinar, which I believe is scheduled for August, we will be talking in more detail around the operational guidelines at that time and the impact of the project on those. But I just wanted to point out there are 8 of them. If you have an interest, you can get them off the NDIA website, as you can also get the rules and the Act and the price guide. All of those documents are available on the NDIA website, and if you have the time to go through them and the interest, much of what I say today may become clearer. I just want to also talk briefly about outcomes domains. The NDIA has been working over the last few years to identify an outcome measurement structure which will assist them to make decisions around whether the participant supports provided are making a difference. These are the 8 outcome domains they've come up with: daily living, social and community participation, home, choice and control, work, relationships, health and well-being, and lifelong learning. They've attempted to create measurement indices or KPIs to go along with these 8 outcome domains, and I presume their intention is to publish a report on an ongoing basis that demonstrates that the scheme is having an impact on them. I'm not sure that they've made that commitment as yet, but nonetheless, the purpose of highlighting them for you today is to let you know that they have done some work around constructing how they will measure the scheme, and we need to be conscious of that in making decisions around changes to how the support planning process works. Because if it's going to be measured using these particular indices, we may need to make sure there's a relationship between what we do and how the indices are measured. I'm going to talk a little bit in detail now about the price guide and price list. So up to this point, I've talked about some of the higher order documents. I've talked about briefly the Act, briefly the rules, made reference to the operational guidelines. I'm now going to talk about the price guide and list, again, available on the NDIA website. The price guide and list is the focus of our activity to this point, and it provides the framework for an NDIA planner to make decisions around what can and cannot be included in a participant's plan. It also advises service providers how much they'll be paid for providing a particular service to an individual, and provides a definition for them to allow them to make a decision about which particular activity they've provided. It's also linked to the NDIA payment system and has a set of numbers that allows people to identify in the payment system how they've provided the service, how much they'll be paid for it, when they'll be paid for it, and it also ticks off on the participant's plan that the service has been provided. It has 3 support purpose categories: core, capital, and capacity building. I can't give you any particular insights as to where those 3 labels have come from, or any thoughts at this stage about their overarching utility. But within them, they have 15 more specific support categories, and I'll go through those in a second. 4 of them are related to the core area, 2 are capital, 9 are capacity building. There are nearly 600 support items, each with an individual price. You can find those in the Excel spreadsheet, which is also attached to the price guide. The support items are made up of a range of things, either a unique activity definition, so something that's special and different that's being provided to a given participant. That activity definition may have multiple entries because it's multiplied by different complexity levels, or it may also be multiplied by different times or days of service delivery. Public holidays, after hours, on a weekday, weekends, etc. attract different rates. But nonetheless, there may be 5 entries for a given activity definition for 5 different times of the day or week that activity is provided, each with a different price. I should also point out that there are separate price guides and lists for very remote and remote areas. The actual list of activities is identical. It's the pricing that goes with them that changes, and there's roughly a 25% loading for those prices in remote areas. This slide's quite small. When I see it on the screen, I apologise if you're having the same experience. This is an attempt to put the last 3 slides into one. This is an attempt to put the last 3 slides into one so that you can see how they relate to each other. The first 3 columns come directly from the price guide. I've added the 4th column myself. So you can see that they've attempted in the NDIA to link their outcomes frameworks to each of the 3 support purpose categories so that they'll be measuring things against each of those 3 support purpose categories using the 8 domains as they're split up there. The next column, the support categories, are the 15 categories that describe the types of supports that people receive within each of the support purpose categories. And I again apologise for the repetition in the language. I recognise support purpose category and support category sound very similar. One is a subset of the other. So the support categories are a subset of the support purpose categories. I hope that makes it a little bit clearer. I recognise, as I say, the language is confusing. So within the core support purpose category, there are 4 support categories. One is assistance with daily life. The second is transport. The third is consumables. The 4th is assistance with social and community participation. Examples of the sort of line items that you can be paid for are in the final column. So they're examples of line items that appear in those 4 support categories. They are things such as transitional support, assistance with self-care, assistance from a living carer, assistance with personal domestic activities. Examples of consumables could be an assistance dog. Examples of assistance with social and community participation could be interpreting and translating, or assistance to accessing community and social and recreational activities. In the capital support purpose category, there are 2 support categories: assistive technology and home modifications and specialised disability accommodation. Examples of these sorts of things are vehicle modifications, shower and bathroom modifications, or wheelchairs. And then the final support purpose category, capacity building, has 9 support categories within it. They are support coordination, improved living arrangements, increased social and community participation. And just as an aside, the delineation between that increased social and community participation and the earlier category of assistance with social and community participation is not 100% clear. And then there's finding and keeping a job, improved relationships, improved health and well-being, improved learning, improved life choices, and improved daily living skills. And the final column provides examples of the sort of activities you can purchase under those support categories: coordination of supports, training in planning and plan management, assistance with accommodation and tenancy obligations, life transition planning, including mentoring and peer support and individual skill development, and so on. And you can read them there on the screen. I won't continue. What's interesting, and what I've identified from the data and received from a number of service providers who are providing advice to the project, is around about 85 to 90% of activity being included in people's plans at the moment in the core support purpose category. Capacity building makes up around 10 to 15%. So it varies between providers. I have one provider who has indicated that 96% of the activity in their agency is core. Others, it gets down to around about 81% being core, but nonetheless, it is a substantial part of the scheme, and something that may not necessarily be ideal for people with a psychosocial disability. People out there may have views on that, but extraordinary amount in terms of balance to be apportioned to one part of the planning process. We're obviously gathering evidence for the project. This is the evidence hierarchy we're using. Published academic journal articles, data collected by service delivery agency, currently using data from 8 agencies that are the funding partners, but we're happy to receive data from other people that have relevant data that can help us to answer questions. Nonetheless, I do have a substantial amount of data at the moment. Evaluations that services have done, have published, opinion built up from personal or lived experience, a consensus of views from a group of people that are represented by people providing advice for the project, reports from government agencies or peer bodies, media articles that are relevant, and personal communication of others who have experienced the system. Obviously, all of that forms different levels of evidence. We're hoping to make the evidence as robust as possible because we're expecting substantial scrutiny from the NDIA. And so we need to ensure that we can cross-reference the evidence as best we can and triangulate it to ensure it's accurate. But we're willing to take evidence from a range of different sources in order to come up with our final opinion. Just to note back to my earlier slide on the rules, expert opinion can come from in a number of different forms, and the NDIS CEO is required to pay attention to expert opinion in making decisions around how the scheme operates. So just to let you know the work we've done to date. We've done a literature review on the relative benefit of support. We intend to publish that literature review with the final project output. We've aggregated client data now from, well, I had another agency provide me with data recently, so I have 8 agencies. 50,000 records be identified. Not all of those will be useful in different ways, but nonetheless I have up to 50,000 records to work with. Development of the addendum to the price guide is well underway. We've identified some new support items and revised definitions, and they're currently being critiqued by the various parts of our governance structure. We've constructed a data set to attempt to identify predictors of support need using non-NDIS like type programs. So what I mean by that is programs that attempt to provide psychosocial support to people who would fit into the category of having a severe mental illness, and therefore the category that's considered to be acceptable for NDIS entry. But we're trying to assess their support needs and their support that is received as a proxy for what could be provided within the NDIS itself. Just analysing NDIS data is just going to tell me how the NDIS currently operates. It's only going to demonstrate how the scheme currently works. It's not going to give me a measure of how it could or should work. The other thing that we're doing at the moment is we're using the National Mental Health Services Planning Framework care packages to identify descriptors that can assist to identify potential NDIS clients from the data set and map that to the support that the National Mental Health Services Planning Framework predicted would be needed for people in each of the care categories. We're fortunate for those who aren't familiar with the National Mental Health Services Planning Framework, it was a project that ran over about 2.5 years and is still being refined within government, designed to identify total service system need based on the anticipated care need of people in the population who may have a severe mental illness. And what it allows us to do is to use the predicted care needs of different groups to start to work towards what typical support packages might need to look like. So these are the sort of, I'm giving you an example here of the questions I provided to the group, and this is how the group was asked, the expert group was asked to consider questions. So this is the process they went through. I'm giving you a bit of an insight into our processes. I asked them, we provided them with a summary table drawn from the literature review that we undertook, and I asked them to consider questions related to possible inclusions to activity items. And the questions I asked were, is there an existing support category or support item that delivers the same activity? Is there a scheme outcome from the outcomes framework that this activity will assist to achieve? Is there a support purpose that the activity fits within? Is there evidence to say that the activity is value for money? Is there evidence that demonstrates that individuals in the system wish to access such an activity? So when the group were considering items from the literature review, they were meant to do that within the framework of these 5 questions. We deliberated over a couple of days across a range of different activities identified by the literature review to come up with a draft set, which, as I say, is currently being scrutinised by the experienced group and by other experts within the project. And we anticipate the opportunity to consult more widely on that relatively soon. This is an example of the table that we used. So this is looking at advocacy and support planning and review and coordination as activities that were identified in the literature review. The second column provided a brief description to participants around what we meant by those particular items, provided a brief summary of the evidence, identified NDIS items that may be relevant and consider as being issues and needs. We identified an outcome domain, and then we suggested some potential line item changes for them to consider. The group went through each of those line items and formed an opinion on either those or additional ones they came up with themselves. So you can see we went through roughly 35 different slides of new or revised or refined items as a result of the outcomes of the literature review process to form an opinion about changes that may be required. I'm also anticipating that we may change. Welcome back, everyone. My apologies for the reception issues. Hopefully they've been improved and you should be able to hear me a bit better now. Just before continuing on, I might take the opportunity to answer one of the questions that's popped up on the screen and give people a chance to sort of ease back into some of the thought processes. I've been asked which are the specific 7 agencies that have provided us with data. They're the partner agencies to the project. In fact, there's 8 of them now, but they're the partner agencies to the project. They're listed on the Mental Health Australia website, and at the end of this slide presentation, we'll provide you with the link to the website. I understand you also may have been provided with some information prior to today on being able to access that particular website. I won't read them all out now if that's okay, but you can get them from the website, and as I say, each of them are funding partner agencies. The other question I've received is, can you find out a bit more about what the non-NDIS-like type programs are? And they're, as I say, programs that relate to providing psychosocial support to people with mental illness that have a similar intent. So I have data from the FAMS program, the PIR program, Day-to-Day Living, the HASI program in New South Wales, the CLS program in New South Wales, the HASP program in South Australia, Doorways from Victoria. I have a range of respite programs, just as a number that come to mind. I also have some PARC program data, and all up across those particular programs, roughly 40,000 of the entries are covered by the programs I've just listed. I might move on if that's okay. So I had just described the structure of the pricing and support list, and I was just moving on to talking about changing the planning architecture. And what I mean by that is focusing how the supports in people's plans are described and constructed on the performance aims of the NDIS as described by COAG in their COAG documentation. COAG has developed a intergovernmental agreement which measures the performance of the scheme and describes the KPIs that the scheme will be measured by COAG. And I'm attempting to align the support planning process to meeting the range of KPIs that relate to participant experiences. And as a result, may suggest that instead of looking at support purpose categories, the core, capital and capacity building, there may be merit in aligning the thinking around supports to the timing of the supports rather than their content. We also are interested in aligning the outcomes framework to some of the work done by Slade and O'Halloran on achieving recovery-oriented goals. Not to try and change the outcomes framework, because I don't think we're going to have tremendous joy there given how much work the NDIA has put into constructing it, but trying to articulate it in a way that has more of a recovery focus and has more meaning to psychosocial disability participants than perhaps the way the outcomes framework is currently articulated. The next stage of the project is the stage we're working on now, which is what I've called categorisations, and it's to attempt to allocate activities to participants on the basis of a default set of groups that participants will fall into, which then allows us to create typical support packages for those groups. There's a range of possible hypotheses. The current one is the dot point around functional impairment, which is the level of functional impairment. I think it's the fourth dot point down. That's how they currently do it. We could look at diagnostic categories, which may or may not be helpful. Types of functional impairment as described in section 24 of the Act. Severity of illness, demographic characteristics, combinations of all of the above, or other models potentially on the basis of the advice that we receive. So what we're trying to do is to find like characteristics that allow people to be reasonably clustered so that when they appear before the NDIA, an NDIA planner who doesn't really have a tremendous amount of understanding about psychosocial disability has a start point for a conversation. And again, just to re-emphasise, it's a start point. It's not intended to be a finishing point. These are the parameters that we're looking at for making those categorisations. They need to be limited to a manageable number. They don't necessarily need to be hierarchical. They don't need to be linear. They can be categorical. However, sometimes categorical variables can be harder to assess. And there's sometimes merit in a simpler assessment process using a linear variable that can be split into clusters. And the other thing is that if we ascribe a different volume of supports and a different amount of funds to each of the categories, they'll automatically be put into a hierarchy by participants themselves. So we need to be conscious of that. They need to be accessible in a reliable form, and that assessment form needs to be objectively valid. We can deviate from the existing structure, but it has to be defensible, and we can't use the NDIS data because it will only demonstrate the existing structure. So we have to find evidence to support changes data because it will only demonstrate the existing structure. So we have to find evidence to support changes that we intend to make. And then the final stage of the project is to take the categorisations and the activities that we've determined to be the relevant activities in the new activity list and blend them together into typical support packages. Just to point out that the details of how the NDIA currently uses typical support packages haven't been made public. I haven't seen a typical support package, so I'm operating on verbal advice from NDIA staff and from advice that Mental Health Australia and other participants have received. It's a particular process that's kept under the counter or behind the desk within the NDIA. Its purpose is a twofold, really. The first is obviously to assist planners to make decisions when planners may not be experts in a given area. That's a reasonable and valid purpose. And the second purpose is to assist planners to manage the costs of the scheme by being able to predict how many people will go into each of the categories and roughly how much each of the categories will cost. It allows the scheme actuary to provide some sense of assurance that the scheme will be retained within its cost structure. That's the reason the NDIA may wish to do it. We just want to make sure that if that's the method they're going to use, that those typical support packages are in the best interests of participants. That's our goal, to ensure that we come up with a set of support packages that provide better outcomes for participants and meet their needs, and as a result also provide greater certainty to service providers around what the mix of services are that will be available and what the price might be that goes with it at the end of the day. So that's the project as we're progressing it. If you have thoughts, if you have literature that you think I may not have come across because it hasn't been published yet, or evidence in internal evaluations you've done that could be useful, and you want to share them, or you just want to send some ideas to me, my email address is up there on the screen right now. It's for those who don't have access to the slides and are only on audio, it's mcgrathda @optisnet.com.au. I'm happy for you to send me your thoughts, and I'll do with them what I can. We are planning further consultation as the project progresses and, again, at its conclusion. So I apologise for talking at you for the best part of 50 minutes. I recognise it's not the most entertaining way to provide you with information, but I'm more than happy now to take questions, to hear what you've got to say and any thoughts you think that may be relevant. I've got one from Craig who's asking, do you think services like HASI will be replaced with NDIS services? That would be a policy decision for the New South Wales Government. I'm not sure how the New South Wales Government intends to align with the NDIS. The only things I can say is that's obviously not a focus of the project, so we won't be making recommendations around how existing state and territory services relate to the NDIS, but it will be a peripheral consideration for how support services get assessed and implemented, because clearly people will potentially be moving from state-based services into the NDIS at given times. Participants may move from one service to another. But the issue of making sure that there is retained the appropriate volume of state services is a big one, and I think we're all worried about it, but it's not a focus of this particular project. Are there other questions that people have, or other thoughts that people want to share? I don't have any currently coming up on the screen.
Just a reminder, ladies and gentlemen, if you wish to ask a question, please type into the chat box on the left-hand side of the screen. I'll wait a few moments to see if any come through.
So, I've been asked the question, how is this work being informed by the pathways work being done through the NDIA? It may be, what I can say is Mental Health Australia is heavily involved in discussions around the pathways work, and in terms of my inputs around how that work is progressing, Mental Health Australia provide me with guidance on how the two things may interface. Obviously, we're concerned to ensure that the work we do doesn't interfere with alternative work that's already underway and may provide meaningful change to the scheme. So I receive inputs from Mental Health Australia on how there's negotiations and how the pathways work is progressing, and if it has a relevant impact on the work we're doing, then we'll obviously make reasonable adjustments at that time. I have another question. What are your thoughts regarding individuals accessing the NDIS for comorbidity of a mental health issue and addiction? Look, it's vexed. Clearly, as I outlined in the earlier slides, the rules, which are communication from the Minister to the NDIA CEO, specifically exclude funding for comorbidities and make reference to drug and alcohol issues as being a comorbidity that would be excluded. I think the issue is not necessarily, however, whether somebody is excluded on the basis of being able to have issues associated with their addiction dealt with. It's dividing the line between what is a clinical service to deal with somebody's addiction and what is a support service to address somebody's addiction. So I think the project has the capacity to provide advice to the NDIA on the sort of psychosocial supports that are relevant to assisting somebody to manage their addiction when they have a mental health issue and are a participant in the scheme as a result of their mental health issue, and assist them to understand that delineation and get a definition that allows people to receive the support they need. I think that's I've kind of given you a sense of how the group is trying to work their way through what's a very vexed issue, and clearly an issue that's important for people participating in the scheme. I have another question which says, am I right in understanding that the project will look at how recovery-oriented services are? Our goal, and clearly we have, using both the lived experience advisory group and people with lived experience on the expert group, as well as the people who on the expert group who have a good understanding of a recovery-oriented framework. Our intention is to ensure that the NDIA understands a recovery-oriented framework and are able to apply that framework within the structures that they have created for operationalising the scheme. So when they're making decisions around what sort of supports go into a person's plan and decisions around how those supports are defined, they're framed in a way that are consistent with a recovery-oriented framework. And similarly, the outcomes that they are seeking to measure, we're hoping to be able to reframe those outcomes in a way that allows them to understand a recovery-oriented framework. Excuse me. I have another question. How much work is being completed on finding a suitable tool for assessing psychosocial disability to inform eligibility and planning decisions? So with regards to eligibility, we aren't attempting to identify a tool for the purposes of assessing eligibility, but obviously when it gets down to categorising people, so if you think that the Section 24 provides the framework for entry into the scheme, we're not attempting to find a tool to measure Section 24. The NDIS has their own tools for that already. But we will need to find assessment methodologies, either using existing tools or creating something that has some validity amongst ourselves to allow people to be allocated to the right planning category for the purposes of typical support packages. That is a tremendous challenge. It's a very good question because it is a tremendous challenge to come up with a right way and an effective way that's valid and reliable of measuring those particular things. But we obviously are conscious of the fact that planners need to be able to make decisions when planners are not necessarily expert in understanding psychosocial disability. What is the path for providing feedback on the project's draft literature review? Well, I think that at this stage, I'm happy to receive comments on the draft literature review. My understanding is I'm not entirely sure if it's been circulated as yet for comment. Belinda, are you able to assist with a comment there?
Hi, David. Yes, the draft literature review has been provided to the webinar participants.
Right.
And with the caveat that it is a living document, so it's not the final, and that as new evidence is captured and considered as part of the project, it will be added into the document. So they can send their comments on that through to ndis@mhaaustralia.org, and that link, that address was provided with the literature review, the document.
Right. Thanks, Belinda. I hope that's sufficient to answer the question, Tina. I have some comments here. One comment that a clinical intervention is a support for functioning. I guess to a certain extent there's a truth in that. Nonetheless, I think the NDIA has been very clear about not allowing state governments to transition funding from their health services into the NDIS. I imagine that's why the delineation is there. I think there's a certain degree of support amongst the expert group for finding the right balance between providing health and other types of supports to people and at the same time not pushing the NDIS into a position where they're unable to negotiate with us on change. I have another question. Will the recommendations you put forward to the NDIA include recommendations about pricing, or will they only concern the type of supports and reference packages? So the project's been divided into two elements. At the moment we are working on, as you rightly identify, the last two elements, the type of supports and the reference packages. I have had substantial feedback about pricing and about concerns about the current pricing structure. I won't be making recommendations to what changes to the current pricing may be required, only to say that obviously with changes to definitions and new items, those items and newly defined items will need to be priced. And there is an intention, I think, to have a pricing project at a later stage. That's a different level, a different set of skills that are required in order to be able to undertake that work effectively. Nonetheless, the issue of pricing has been noted and there is an intent to tackle it at a later stage, but not at this stage of the project. Noting the NDIS reaction to the Mind the Gap report, are there any concerns on their response to this project? Well, we are engaging with the NDIA and we anticipate that there'll be certain elements of the project that they'll be supportive of and be able to engage with relatively quickly, and I also anticipate that there'll be parts of the project that will require substantial explanation to them before we get them to agree to any change. There's no guarantee, of course, that they will change anything. But just noting back to the rules that require them to seek expert opinion on planning decisions and making deliberations around what is effective and beneficial support, there is a requirement on the CEO to pay attention to the advice that we provide. And obviously there's an advocacy component to the project, which Mental Health Australia will be leading on once I finish my technical work. And we'll be ensuring that the outputs of the project are available for consideration in the most appropriate way for people within the NDIA. But of course, no guarantees. At any stage, do you think the remote issue will be looked at further? Where I'm situated, we have a community full of those with psychosocial disability. However, they are remote but still fall under non-remote area. This means planning is done by LAC and planners reflective of this. The services want to and can charge more. I'm not intending to look at the pricing of the remote issue or the defining of what is or isn't a remote location. What I can say is there will be a suite of policy issues that have come up throughout the project, which will be mentioned at the end of the project report as project issues the NDIA should be aware of. We won't be making particular recommendations on that though, as we haven't sought to generate evidence or advice, nor do I have time to do that effectively. I'm very conscious of making sure that any recommendations we make have a solid evidence base and are open to the sort of scrutiny I anticipate will be coming from the NDIA when we put it forward. I've been asked, the review is complete by August. What is the process from there? That's probably a question better answered by Mental Health Australia, other than to say just giving Mental Health Australia a few seconds to put their thoughts together. We obviously intend to advocate on the outcomes of the project to both opinion leaders and also to people who have the capacity to change the existing documentation. And work's already begun to build relationships with the appropriate people inside the NDIA and surrounding the NDIA to ensure that they understand the importance of seeking change in these areas. Belinda, do you want to add anything to that?
Yeah, thanks, David. Part of our advocacy strategy is, as David just described, and the work's already begun to socialise the project with the various areas within the NDIA that this work relates to their own work, but also to provide a full briefing to the Disability Reform Council so that it understands, so all of those disability ministers from all jurisdictions truly understand what this project is about, why we did it, and how they should also take the expert opinion about what typical support packages should look like for people with psychosocial disability. And then we will also be doing full briefings for the relevant Commonwealth ministers on the project as well. And then it will inform all of our ongoing advocacy in relation to improving the experience or the NDIS experience for people with psychosocial disability. And the reason for holding this webinar is to get you in the sector also familiar with the project so you can start talking about it with some good grounding on what the basis of the project is and the methodology that underpins it. Thanks, David.
No problem at all. I've been asked reassessment tool, what do we know about the 2 New South Wales trial sites for trialling Orange Go trials? Well, I haven't got a tremendous amount of information from those trial sites at the moment, and I don't imagine, if I think back to the data set that I have, I'm not sure that I can draw out participants that may be participants related to those particular trial sites, although it's a reasonable point, and I may see if I do have the capacity to go back to the agency to provide me with data and see if I can do that. Thank you for raising it. At this stage, I don't have specific information from the trial site. It may be buried in the data set, though, and I will go back and see if I can find it. I've been asked what's the anticipated time frame for the remainder of the project. We anticipate it being finished by the middle of August. We have a process where it needs the outputs of the expert group need to be filtered through the other parts of our governance process before it comes to a final endorsement by the project partners. But we expect that the technical part of the work, anyway, will be done by the middle of August. Then there's obviously an advocacy component which comes after that, which will allow us to begin negotiation with the NDIA. Having said that, we're obviously, as I say, engaging with relevant people within the NDIA already and people around the NDIA who are part of the superstructure that it sits within to engage them with the concerns that the sector has and to ensure that they understand that this work is being undertaken and it may be relevant for them in terms of improving their processes with regards to people with psychosocial disability. I think I've addressed most of the questions. I can't see any that I've missed. I think I've addressed most of the questions. So, hang on, I've got one more that's just come in. I'm interested to know. I hope the sound. Someone's just noted that the sounds may have disappeared for them. I hope nobody else is having the same experience. I'm interested to know how feedback on the NDIA and the project being obtained from vulnerable and marginalised cohorts of people, such as individuals in prison, homeless, those in supported residential facilities, called and very remote communities. In a range of different ways, I guess. So I'm able to identify a number of those particular cohorts on the basis of the data I've been provided. So I'm able to get both measures of the supports they've received, but also some of the outcome data that they filled in and their assessments of their own needs using the Kansas tool. And so I'm able to get, as I say, identify subgroups and get some data on their experiences and some of their identified needs. Also, we have a lived experience group and we have lived experience members on the expert group who are able to provide experiences that relate to some of those categories. I'll acknowledge we haven't specifically sought to identify each of those categories for the expert group, but nonetheless we do have people providing us with their particular positions on things who have some experiences in some of those subgroups. We do recognise the need at the end of the process, though, to test and socialise the product appropriately, and we do intend to do that in a way that will allow us to test some of our assumptions before we take it into the advocacy domain. And I'll just give another couple of seconds to see if anybody else wants to ask any questions before I wind it up. It looks like we may have exhausted people's thought processes. So thank you again for taking the time out to engage with this project today. It's very helpful from our point of view to know that there's a substantial amount of interest out there and that people are wanting to assist us in being able to take this important piece of work forward. And we hope at the end of this process we have a much better set of outcomes for people with psychosocial disability in the scheme. Belinda, do you want to provide any concluding remarks before we sign off?
Thank you, David. Thanks everyone for participating. We understand that you know, the engaging by webinar is kind of a little bit tricky for us all, but it's also a very good way of at least being able to give everybody information without it being a travel burden on anyone. But please, after you've read the materials and had another look at the web page and all of the information about the project there, if you've got any questions at all about the project, then please email them through to ndis@mhaustralia.org, and Kath and myself will get back to you as fast as we can with responses to your questions. But the other thing we'll do is, with your questions, you're giving us an indication of the, that the rest of the sector will have similar questions. So we'll create responses to those questions and put them up on the web page as well. So your questions will be other people's questions as well. So please send them through. And thank you again for your participation today.
Okay, thank you everyone, and I look forward to giving you the output for the project at the end of the project. Thanks very much. We'll sign off now.